set to begin. One moment, please.
Thank you, dear Heather, and hi everyone. I'm Karmit from Israel. And you can see here my colleague, Barbara Fellon. And we are very happy. We are very happy to be here today. And okay, so good morning, good afternoon, good evening, and good night to our dear colleagues worldwide. Both Professor Fellon and I are excited for this great opportunity to provide you with a glance into the first volume of Child Abuse and Neglect special issue on protecting children from maltreatment during COVID-19. We are full of appreciation to Professor Christine Weckerle, the Editor-in-Chief of Child Abuse and Neglect, for the great opportunity that was provided for us by editing the special issue and for her continuous support and guidance. We would also like to thank Ispcan for being the leadership of our field. Thank you for this groundbreaking journey together. Last, but certainly not least, we would like to express our deep appreciation to you, our dear community of practitioners, researchers, and policymakers worldwide who are devoted to the protection of children. This hectic time of COVID-19 make it clear for us that we are all in this together, and we will continue to do our best efforts to make sure that this world is safe for all children at all times. Today, we will spotlight the first volume of the special issue, but it is important for us to emphasize that the second volume is on its way and there is much more to anticipate. Today, we will focus on the three themes that appear in our first volume. The first one is the impact of COVID-19 on individuals and parents. In a study that was conducted in Israel, the researchers examined whether exposure to child abuse is related to higher risk of COVID-19 related fear and acute stress symptoms, and whether complex post-traumatic stress disorder is a mediator. In the sample, which was comprised of over 800 participants, the key results pointed that participants who experienced child abuse were more likely to have COVID-19 stress symptoms. Also, it was found that exposure to child abuse is associated with elevated levels of fear of COVID-19 and COVID-19 acute stress symptoms through the mediation of complex PTSD symptoms. And from adult survivors of child abuse, we will go to adolescents with pre-pandemic experiences of maltreatment. A study that was conducted in China, the researcher examined whether exposure to COVID-19 predicts level of anxiety and post-traumatic stress symptoms, and whether pre-pandemic maltreatment exacerbates this impact on mental health in adolescents. This sample comprised of adolescents aged 11 to 18 with a sample of over 6,000 adolescents. The key results pinpoint that more pre-pandemic maltreatment experiences predict more stress and anxiety, meaning that both in the study that was carried in Israel and in the study that was carried in China, we can see that amongst adults, survivors of child abuse, and adolescents with pre-pandemic maltreatment, COVID-19 was related to more anxiety and post-traumatic stress symptoms. From those individuals, we are going to parents. In a study that was carried in the US, the researchers examined the impact of COVID-19 pandemic in parental perceived stress and child abuse potential. Over 180 participants of parents with children under the age of 18 conducted several questionnaires and the key results indicated that greater COVID-19 related stressor and high anxiety and depression symptoms were associated with higher perceived stress in parents. Not only that, but it's important to stress that the need for financial assistance with mental health symptoms was associated with higher likelihood of child abuse. It was also found that greater parental support and perceived control was associated with lower perceived stress and child abuse potential. Another exploration that was carried among parents and the impact of COVID-19 was also carried in the US, and the researchers investigated factors which were associated with child maltreatment during the pandemic and whether cognitive reframing moderated associations between COVID-19 and child maltreatment. More than 300 parents completed online questionnaires, and the results clearly indicated that parents who lost their job during the pandemic were significantly more likely to psychologically abuse their children and physically abuse their children. Not only that, but parents who had history of abusing their children were 112 more likely to psychologically abuse and 20 times more likely to physically abuse their children than parents without a history of abusing their children pre-pandemic. The researchers also addressed that the use of reframing coping strategies was found to mediate the likelihood of physical abuse. Another study that focus of parents was also came from the US, and the researchers examined the relationship between material hardship and stress among grandparent kinship provider with mental health as mediator during the COVID-19 pandemic. In a sample that was compromised of more than 350 grandparents kinship provider, the researcher explored those variables and found that material hardship was significantly associated with a higher likelihood of experiencing parenting stress. This relationship was partly mediated by the grandparents' mental health. This line of study only stress and illustrate to us as a community how crucial it is to support parents in order to provide children with protection, and how challenging it is to protect parents and to provide them with support during COVID-19, which condemns with the parents not only with health challenge, but also economic and mental health. Acknowledging the various challenging contexts in the lives of both children and parents takes us into the second theme of the first volume, which focus on policies. And we were asking ourselves what kind of policies exist around the world, because many policymakers worldwide were naturally occupied with how they can mitigate the COVID-19. So like countries in which policymakers were worried about children's safeties as well. We will give you really partial answer for this question, and in our second volume, we will have more about policies in additional countries. We will also have a study of an international examination of policies worldwide. So in a study that one conducted in South Africa, the researchers investigate how COVID-19 legislation enable the protection of children in South Africa from abuse and neglect. The researchers identified 7 documents, and the documents analysis identified that those regulations actually adhere to how children can be protected from COVID-19, how to ensure the uninterrupted protection of children at risk, and how the social protection of children and disadvantaged households can be advanced. So if you're asking yourself, what is the problem? Well, the problem is in the dissemination, because the researchers identified a worrisome gap between those legislation that they identified and between what actually happened in South Africa. In an attempt to reduce this gap between what legislation is declared and what really happened in practice, a group of scholars from Great Britain tried to propose a conceptual framework to the way policy can protect children in time of pandemic. Those researchers pointed into several key components. The first one is the urgent need to more holistic and child-led flow of information across both micro and macro systems in the children's lives. Not only that, but the researchers emphasize on the need for a child development approach in those various systems. And they suggest the need to recognize the importance of effective digital mediation services during this practice and during policy. In a study that was conducted in Germany, the researchers gathered literature, both academic and non-academic in Germany, and they tried to analyze from this literature what are the key challenges for the protection of children from maltreatment during a pandemic. The researchers found several challenges. The first one is that there is a large stress on families and heightened risk due to the pandemic stress on the system. For example, the researchers indicated on increased risk in domestic violence and sexual abuse and increased demand for remote counseling. They also said that in some cases they learn about benefits for family life. In few cases, increased cohesion, increased communication, but please notice, when there are no economic or health burden. So only people who had enough money or good enough health or good enough support were able to actually enjoy this family time. The key problems the researchers indicated was loss of standard reporting channel and especially the lack of school, because we all know that school, especially in time of COVID-19, was revealed to us as core component in the protection of children from maltreatment. And they also emphasized the difficulty of maintaining contact with clients they know of, both children and parents. Going from Germany, we will go to Japan, in which the researchers try to further understand the central role of schools in children's life. More specifically, the researchers try to investigate the effect of the first wave of the pandemic on suicide among children and adolescents in Japan. The results show no significant change in suicide rates during the closure, but suicide significantly increased in May, immediately after the lockdowns. The researchers said that it was no related to school closure during the pandemic, but it is important for us to stress that we need more studies in order to further understand this direction. As we discuss in various forums, there is a great fear that we will see increased suicide rates from a group of population that we are not aware of before. From Japan, we're going back to the US, in which the researchers focus on children and youth in care. And those researchers try to examine the phenomena of rapid return of children in residential care to family as a result of a policy. The researchers, using mixed method design, understood that the rapid return didn't allow for adequate child and family assessment. but with appropriate support, the participants in their study, mainly practitioners who work in residential care, believe that some families can actually protect and provide safe context for their children. However, they did display primary concern for their children, unresolved separation in the past, lack of capacity in their homes, limited monitoring, lack of access to education. All of this might put further challenge on families that from the beginning needs further support. The key recommendation of those researchers were to develop support strategies, to invite child and family encourage communication, and also to advance case management in those cases. And we will go from the policy of the US, or at least some counties in the US that went to rapid return of children, to South Africa, in which children and youth in residential care remain in those places. And the researcher tried to explore the experiences and the impact of the pandemic in social isolation on the well-being and the protection of the children from their own children perspective. This is one of the few studies during the pandemic that spotlight children perspective, and they did so by using draw and write method with 32 children. The children in their study shared negative emotion from COVID-19 and from the social isolation. More specifically, the children share feelings of fear, sadness, anxiety, and they also were concerned about the safety and well-being of their families and communities. However, the children were aware of the resources available at the facility that they had, and that helped them cope and kept them safe. So this study actually illustrates for us the way that policy that kept the children within the residential care actually advance their resilience in a way that they provided them resources. And even though they expressed great fear, sadness, and anxiety, they knew what the resources of support were for them. At this point, we will go to challenges and intervention. Barbara.
Thank you very much, Dr. Katz. And can I just applaud Carmet for her incredible leadership in convening a large group of international researchers interested in service to children and families. And these discussions have been incredibly helpful for our work in Canada. The other context to consider is that these papers represent, I think, a significant volume of scholarship and work that was conducted very early on in the pandemic. People were able to mobilize resources and conceptual frameworks and interventions very quickly, and these papers really point to the impact on children and families of the pandemic, not only because of infection, but because of the restrictions imposed to control the infection. And so many of these themes, as we look, as the research literature emerges, so many of these themes have really emerged as fundamental issues for children and families as a result of COVID-19. The framing of the volume, I think, was also very much informed by the Alliance for Child Protection and Humanitarian Action and the ecological model that they first presented early in 2020 and have subsequently refined. That was extremely helpful for us to frame the work of these fantastic researchers. So these next series of papers really, as Carmen mentioned, speak to the interventions. The first one was a paper done by Gilbertson et al. And looked at recommendations for service providers who are working directly with vulnerable children. The conditions imposed to restrict infection presented a number of challenges for frontline workers. And this group of researchers really wanted to understand the impact of the pandemic and our response for vulnerable children and families. so that those subsequent interventions could be informed through data. They used a mixed methods design, and they conducted an online survey of representatives non-government that were completed by, the survey was completed by representatives of non-government organizations. And what they found was that the response measures were highly associated with increased risk factors for vulnerable children and families. And at the same time, NGOs were experiencing decreased financial support and an inability to provide the services that children and families were asking for and were in need of. And the recommendations were very clear in that there needed to be strategies for service delivery, and that they had to be quickly adapted to new constraints, ones that could facilitate connections with service providers and families and children, and that empowered the communities in which children and family resided. The next paper, I believe, is from Indiana, and Schwab-Reese et al. I think this was it was such a perfect title for this paper. Oh, this is actually okay. And it recounted how Indiana provided training to adapt to the conditions of COVID-19. Specifically, they looked at whether there were differences in learning outcomes between the learners who completed the training and those that were trained as usual. It was a qualitative thematic analysis of the interviews with caseworkers, and it also assessed quantitative measures, which were looking at differences in learner knowledge and satisfaction behaviors both pre and post-COVID. They did not find as many differences in learner outcomes with respect to knowledge and satisfaction, but one of the main takeaways was that organizational culture was central in facilitating this transition. External constraints caused challenges during the transition, but it also presented opportunities to evolve training practices, and those were deemed as positive. And then a very interesting paper by Philo et al. Looked at child protection professionals in Brazil and their behavior as they adapted to the needs of children and families during the COVID pandemic. Specifically, the purpose was to look at individual and socio-ecological predictors of whether CPS services or child protection services were able to engage professionals in the development of resilient behaviors. They looked at 309, their sample was 309 child professionals that were working in child protection services, and their data collection instrument was a survey on resilient behaviors, and they used those resilient behaviors as predictors. What they found was that job support, so the organizational support for child protection workers, were very central in the promotion of resilient behaviors, and also the individual beliefs. So the child protection workers' belief in the importance of resilient behaviors in their practice was also seen as central in this paper's findings. And then Racine et al. Looked at telemental health for child trauma treatment during and post-COVID-19. Certainly, much of the work that could not be completed in a typical face-to-face manner were morphed into a telehealth delivery, and this group of researchers were very quickly decided to evaluate the efficacy of that intervention. Specifically, it looked at the benefits and barriers to telemental health in a child maltreatment population and provided some very helpful recommendations, I think ones that are very prescient in COVID-19 January 2021. They found that the benefits were some data that a telemental health intervention was as effective for treating child mental health as in-person treatment. It could reduce the barriers to treatment with respect to time considerations, travel considerations, transportation, costs associated with a face-to-face visit, and that the digital connection was perhaps facilitated access to more remote communities. The limitations were that for some populations and in some geographic regions, there was a lack of access to technology and the internet, and there wasn't necessarily access to a confidential space in which to deliver the intervention. And certainly there were some children that they found that could not be treated as effectively via telemental health. The assessment of the presenting problem also posed some difficulties. And then so while they found the telemental health could produce some benefits, that it should be carefully considered on a go-forward basis. And then I think the last paper is one that we did at the University of Toronto, but really in Ontario with a group of agency people, and in Quebec with my colleague Delphine Colin-Bessignier, and we've implemented it in a third province. And that was a group of administrators really and researchers coming together early in March to think about how we could assist frontline child protection workers who weren't able to visit families face-to-face, but needed to make sure that they were constantly assessing for economic hardship and the family's mental health concerns. So what we did was to develop a tool, we call it a checklist, essentially that is easy to administer and is at maximum 10 items that systematically takes a worker through the constructs that they should be addressing with families, from economic hardship and need to physical health, to mental health. And although those constructs have essentially have essentially reflected the same constructs that we identified in March and April, the resources that the worker could access depending on the family's answer to the item have been continually updated. So as learning and public health instructions change, then we were able to adapt the tool to reflect the new instruction and the new requirement. We used data in Ontario and in Quebec that we had to do a factor analyses to make sure that our assumptions about COVID were also reflected in typical child protection work. And we have subsequently built out that tool, and I think we now have 10 checklists that are being adopted in other jurisdictions other than Canada. And now Carmen and I are happy to answer any questions and hopefully to facilitate a discussion about the important work that people listening to this webinar are probably doing, and perhaps there's been some updates about the key themes and results that were presented in this paper.
Great, thank you so much. Oh, go ahead.
Oh, sorry, I was just checking with Carmen. Is that right, Carmen? Is there anything else to add?
This is perfect. Thank you.
Okay, great. So just a reminder to everyone in the audience, if you have a question or comment about any of these papers or in general, you can type it in the questions box and we'll be happy to ask the presenters. We have a couple questions about specific papers. This one I believe is related to the resilient behaviors paper. This person is asking if you can give an example of personal or job support resilient behaviors. Going back to that one.
Thank you. That is a really great question. So an example for a personal behavior was taking a free time, doing sport activities, having free time to yourself, and about organizational behavior. It's providing emotional support, prevent second traumatization among the workers.
Okay,
And
all
I
right,
think,
great. Yes.
sorry, Heather, just to add, I think um, that's a theme that we see, subsequent to this important paper with our work with agencies in Ontario, where if a agency is able to support workers transitioning to largely working from home, assisting with the technology that is required, giving them time to address their own family's needs, and staggering their hours in ways that perhaps sometimes are more amenable to child protection work, because of the families that they're working with may not be able to engage with workers on a 9-to-5 basis. So those specific job supports have really been seen as very seminal in terms of supporting frontline child protection workers work with families.
Okay, great, thank you. This is another kind of specific question about the Brown et al. Paper. He's asking about perceived control and if that is around COVID-19 or something else.
Around COVID-19.
Okay, thank you. Great. Let's see. Here's another one. One moment. Okay, this question is a little more general. This person says, it seems that COVID-19 lockdown is a risk factor for child maltreatment from a variety of the articles. Is there any assessment of the use of Tele-Assessment in child protection agencies with children who are reported to be at risk?
That is a very, very good question, and the gathering of the data, it still is in initial stages. I will give you like a short trailer to the second volume of the special issue, in which various studies will provide part of the answer for this question. So we know that the lockdowns are really increased all the risk factors for children. For example, we see increase in domestic violence, we see increase in parental stress, we see increase in mental health, we see closure of formal and informal system that's supposed to protect children, right? So all the natural environment and formal environment of protecting children is shut down because of the lockdown. But at the same time, the worrisome picture that we can see is the decrease in child maltreatment rates in many countries worldwide. And we think that it is not because the children are less at risk, but the contrary. It is because we don't have enough indicators and enough system to see those children and to identify the risk and therefore to report on them.
Okay, thank you. We have lots of questions coming in all of a sudden. So the next one, this person is asking about children with disabilities. She says, are there papers specific to safeguarding children with disabilities, learning difficulties, or social communication difficulties in the pandemic that you could share?
This is such an important question, and unfortunately, currently we're not aware of such work, but we do have to say that in a conceptual framework paper that will be, again, displaying our second volume, we're discussing and trying to map and characterize various risk factors for children. And one of them is children with disabilities, because think about, for example, the factor of parental distress. It is, of course, that parents who have children with developmental or emotional disabilities, their parental stress is far escalated in times of COVID-19. All their informal and formal support is taken away from them. And we also know that there is increased risk in the exposure of those children, all the children, but those children specifically, to the internet, right? To online maltreatment and sexual abuse. So we really feel for those children, but we saw two things. We saw that one, I'm not aware of studies that were carried specifically on this perspective, but two, in analysis of the policies, not only in Israel, but in additional countries, we didn't see any specific consideration to children with disabilities, meaning that most of the discussion was going towards all children, which is important, but we know that for every pandemic, there is the social character of the pandemic that suffer more from the consequences. So sure enough, children with disabilities are more prone to the various adverse consequences of COVID-19. But not only that we don't know enough of, but there is no enough policy and legislation specifically to this group.
Yes, and I would just add, I think, and relate to the earlier question, that there's an absence of data, and particularly around the impact of COVID-19 on children with disabilities. We know that they have an increased probability of morbidity and mortality. We know that there are increased barriers to education, that children with disabilities are more likely to live in congregate care. So I guess that the question is a very important one to in Carmet's initial remarks, absolutely, and that the complete lack of data is about children living with disabilities, the impact of COVID on their life and on the potential for maltreatment is a really seminal issue for our community.
Okay, thank you. Here's a question about the tools used in Ontario. She asks, can those tools be shared? And also, are there any good practices around supporting frontline workers under COVID that you can share? And then thirdly, have such tools been used for Indigenous communities in Northern Ontario?
So the answer to the first question is a three-part question. It's going to test my short-term memory. So the answer to the first question is absolutely. I think my email is somewhere on these slides, and we are thrilled if people use the tool. That's really what we would like to have happen. We have small working groups, and we're working to adapt them in for all kinds of situations. We have Indigenous or First Nations, Métis Inuit specific resources attached to the items. In some jurisdictions, we've adapted those resources to reflect the geographic practices or resources as well. And the delivery of the frontline tool, we're working on a little bit. With some work that we've done in New Brunswick or Quebec, we've realized that in curating all of the resources that could potentially be helpful to any family situation, that it's a bit overwhelming for workers because they have 12 or 15 resources to become familiar with for one item. So during our working groups, we're undergoing a process of refinement where we're just sort of curating the top 4 or 5 resources that are likely a good response to the item. So we're happy to share the tool, and we're happy that any jurisdiction use them if they're helpful.
Okay, great. And then she had asked if they've been used for Indigenous communities.
They have been endorsed by ANASTIO in Ontario, which is so in Ontario, the Indigenous Child and Wellbeing Agency membership is ANASTIO, and they have endorsed the tool. And so some agencies are able to use them. I'm not really sure to the extent of the uptake, but certainly within the tool and within items, we have First Nation, Inuit, and Métis specific resources embedded in them. So we're happy to have further conversations if that's helpful.
Great, thank you. Here's a specific question for the Racine study. This person is asking, do providers specify treatment of children to include sessions where parent and child are present, as well as individual treatment for either parent or child? Hopefully that's clear.
I am not sure. I'm not sure of the answer to that question. Carmen, do you know?
Can you repeat the question, Heather?
Yes. She's asking, do providers specify treatment of children to include sessions where parent and child are present, as well as individual treatment for parent or child?
Yes, actually, they really, there was a small discussion of this, but it's not elaborated enough for us to further provide details on it. They just say that when considering the telemental health case to case, it should be considered whether it's with only with children, with parents and children, and so on, but it was not elaborated.
I think it was a broad finding.
Yes.
So I guess I would be more interested in the rationale behind that question. It sounds like an important one.
Okay.
Yeah.
Yeah, I don't know if she can type more if she has more to say. Okay, well, let's move on. Here's a question. I think more of a general question. What are the new or innovative methods used to engage children for getting information quickly? Any specific good practice in using online methods to engage and connect with children for child-led information flow? How can children effectively participate in the solution also?
That is such a great question. And we're really trying in our international group to further examine this because during the pandemic, when children are locked in their house, our approach for them as researchers is even more limited. So in one study that we saw, not in the first volume, we saw a study in which they analyzed posts and referrals of children to online forums. And this was a great platform for the researchers to learn about the children. We also saw in another policy draft of one of the NGOs, that I cannot now retrieve the name, that they declare on the importance of collaborating and advanced children participation during the pandemic. But unfortunately, I didn't see a lot of writing or even a little writing on this. I can tell you one thing from Israel that we haven't write on it because it was not a study. It was our attempt to learn from youth about how we can approach them and provide them with help when they are locked in their homes. And what they told us was amazing, because they told us that they feel that during COVID-19, they have no right to communicate any of their difficulties. And I want to emphasize, those are not children who are acknowledged at the welfare. Those children who are very activist in their daily life, and we were just trying to approach them and to learn from them how to engage children. And they say that they feeling they have no right to communicate any difficulty during COVID-19 because they are less important than everyone else. They are less important from the adults. Their parents have so many problems, so much economic burden, and so much loss and pain. So even with something really bad will happen to them, so they don't think they have the right to communicate with anyone. And I don't know how relevant it is to other countries worldwide, but I must say that in Israel, it really reflects the social approach to children during pandemic. Like during the pandemic, we saw that children in Israel were actually unseen, invisible children. So maybe because of this social context, and lack of policy which approached children, this was the children's narratives. But I don't know how it is in other countries at this point.
I guess I'll add, Clement, to your remarks that I think the age of the child is not a small consideration. I think younger children, it's been very difficult for workers through digital access to do the assessments and to hear directly from younger children about their experiences. I think that the adolescent population, it may be, if they're involved in the child welfare system, it may be easier for workers to hear directly from adolescents. They're more familiar with the technology, with texting, with online platforms. That said, we've tried in our checklist toolbox, we've tried to develop specific tools to address to address the important question from the attendee, and that is, how do we hear from younger children and how do we engage adolescents, particularly if they identify as having pre-existing mental health concern or one that has emerged because of the restrictions imposed to minimize infection. But the developmental piece to that question, I think, warrants very specific kinds of responses and interventions.
Okay, thank you very much. Here's a question going back to mental health or social services workers or providers. This person, and you may have touched on this, but she's asking if you know of any work or research that's been done regarding the stress and mental health effects of COVID on these mental health or social support providers.
Carmen, I do not know of one. I don't think we have a paper on that in the second volume. Is that right?
Yes, we don't have any on this aspect.
It would be, I don't know if jurisdictions have actually undertaken that work and in an unpublished survey, but it would be a very important one to undertake if people haven't.
Okay, thank you. Let me just take a quick review of the questions that have come in that I haven't gotten to yet. Hold on.
No worries.
Okay. The person who asked the question earlier that you'd asked the rationale for said you answered her question. She says it
That's
seems tricky. She says it seems tricky to get information about maltreatment when the children are young and at home and in home place. Yeah. Well, I think I'll go to kind of a broader question, maybe as we're getting closer to the end here. One of the attendees kind of posed the question, if you reflect on this whole group of research in this issue, are there any kind of main takeaways that you see from all of this international research?
Yes, definitely.
Yes, for me, I guess my first reflection is that the pandemic has exacerbated structural and systematic inequities in ways that we need to ameliorate as a community that cares desperately for children and families. And so in every paper and every research, the question about disability, any vulnerable population, they have been impacted by the pandemic in ways that we should have predicted, and in ways that will continue to be there unless we address systemic racism, equity, diversity, and inclusion issues. That would be my first reflection, Carmen.
Yes, I definitely relate to what Barbara just said, and I think both Barbara and I were really amazed by how fast the researchers in our community respond to the pandemic and really adhere key questions in all kinds of innovative methodologies, even during the pandemic. And I think that those studies really illustrate to us the significant role that research has in protecting children, because those research will really impact policies from the first to the second wave. In many countries, for example, in the first wave, the awareness for the child maltreatment was almost non-existent. Like in some countries like Canada and Germany and Australia, it was very central, but in others, it was invisible phenomena. But thanks to the international attention and the researchers' responsibility towards the protection of children, those initial results really, really helped to inform policy. And the second thing that Barbara touched upon is the need to further adhere to issues of intersectionality during a pandemic. I think that future efforts of our community should go into this direction. Preschoolers children, children with disabilities, children who are far, far behind any online connection. If I'm thinking of Israel, we have so many villages of Bedouin children who doesn't even have electricity. So how can we talk about telemental health and children with trauma if during the pandemic those children are really locked down, far behind anything else? So those are definitely to take away from this first volume into our future efforts as a community.
Okay, great. And to expand on that, looking back at the past year and where we are now with the pandemic, can you recommend types of data that you think should be collected now and in the future, or topics that should be focused on?
Well, I mean, I think the pandemic has illustrated a dearth of data about our most vulnerable and children and families. So that's an overall observation. One of the issues that I prevaricate about, wake up in the middle of the night thinking, is the academic gap that will emerge between children who already start the education system well behind their peers, and the importance of measuring the academic loss that the pandemic has produced so that we can ameliorate it and we can design interventions to ameliorate it. I cannot underscore enough. My worry is when I see policies like your child will receive the same grade as pre-pandemic. Don't worry. I think, oh my goodness, we really have to, remove the grade issue and like what is the extent of the academic loss? What is the academic plan in place to ameliorate that loss? And how are we going to ensure that children get to where they need to be post-pandemic, given the impact on their educational trajectory?
Okay, Karma, do you have anything to say about types of data you think should be focused on?
Yes, I totally agree with what Barbara just said, and I also want to add to this the societal context of the pandemic. I'm really worried about the impact of the pandemic on our social and our dynamic of people and neighborhoods, more specifically about racism. And I think that something in the social isolation might impact social distancing and might even escalated display of racism. And I think about those children in those communities who were already far from the formal authorities and there was suspicion towards them. And what happened during the pandemic when those groups faced racism? For example, in Israel, Arab children, and accusation that they are spreading the COVID-19. So what will happen to child protection services in the day after COVID-19 hopefully will be behind us? I think a lot will need to be explored there on the adverse impact of the pandemic and on the way we can better adhere those consequences.
Yes. Great, thank you. And to maybe just end on a positive note, it sounds like raised awareness around child maltreatment in general, as well as inequities among children, has been somewhat of a positive during this time. Is there anything else you can say about any positive effects on child protection systems that have come out of the past year?
Well, I mean, it's interesting. There was seen paper um, is speaking to a finding that I've heard anecdotally, which is that in many ways it's easier to access remote populations or difficult to access populations because of the digital communication that COVID has essentially forced us to engage in. But that may be something, that modality, that treatment modality is something that we need to evaluate, certainly understand, but potentially going forward can have some very good outcomes for children and families.
Okay, great. Carmen, anything to add?
Yes, to end on a positive note, I think that COVID-19 really brought us closer together as a group of, as community who cares for children and for their protection, and something with the Zoom everywhere and webinars really make it easier for us to just communicate on those issues and collaborate on this on a daily basis. And I think that the pandemic made us stronger communities and more advocates who will do whatever it takes to protect children. So I'm very optimistic about our future efforts in this field.
Great. Well, that is a great note to end on. And on that note, thank you again to Barbara and Carmet for sharing all of this information with us today. And thank you to the audience for joining us and for your great questions. If you have a question that didn't get answered, we will make sure that the presenters have those questions and put you in touch so you can get that answered. So I would just like to conclude with a couple slides about Ispcan. Hold on one second. Oops. Okay, so we would like to encourage you to become a member of Ispcan if you're not already, so that we can continue having webinars and trainings in the future. Our member benefits include a subscription to our monthly research journal, Child Abuse and Neglect, access to our past webinars and other educational resources, the Ispcan child abuse screening tools, and discounts to our congresses and trainings. This includes our upcoming training series on a multidisciplinary approach to abusive head trauma, which will take place in March. We offer several membership levels, including our new associate membership, which is just $35 a year. We also would like to invite you to visit our COVID-19 resources page at ispcan.org to access a variety of resources for different disciplines, as well as for parents and children. And a reminder that a recording of this webinar and a PDF of the slides will be available on our website shortly at ispcan.org. If you're interested in presenting or have ideas or topics for webinars or trainings, please contact us at resources@ispcan.org. Thank you all again for joining us today. Please stay safe and have a great day or night, depending on where you are. Thank you, Barbara. Thank you, Carmet.
Oh, thank you, Heather. Thank you.
Thank you.
Okay, bye-bye, everyone.
Bye, Carmet.
Bye, Barbara. Bye. Thank you.